Hey everyone, welcome to the live stream. Today we are going to be talking about jobs. I'm actually going to pull up some active job listings and dissect some of the meanings behind things in the listing. Things like what are the preferred qualifications versus the required qualifications, the different certifications you might see, things if we come across it, like things about what a contract position is, what that means for the company, what that means for you, things you need to consider. So, right now, we're going to sit back, we're going to relax, and we are going to get ready for today's live stream. Hey everyone, welcome back. It is a damp day here in Pennsylvania, let me tell you, but I'm excited because I'm here with you guys and we are going to check out some job listings today. Now, one of the first things I want to talk about is the difference between the types of medical coders. It's not exactly an exact match, but I would say medical coding is kind of like saying you're an engineer. Like there's different types of engineering, right? There's mechanical engineers, there's software engineers, there are computer engineers, right? So saying that you're a medical coder doesn't necessarily mean it doesn't give you the detail of what specific type of coding you do. There's different types of coding. Let's say hi to some people that are joining us in today. We have Misty joining us on YouTube. We have Ladreba. Good afternoon to you as well. We have Kim joining us from YouTube as well. Where are my LinkedIn friends? Oh, there's Lori coming in on Facebook. Hi, Lori. So, yeah, one of the first things I want to talk about is the kind of breakdown that we have in types of coding, what types of code sets you use for them, as well as the certification specific to those. So let's full screen and we'll get into it. But yeah, if you have questions along the way, definitely let me know. By the way, I need you guys to help me out with something. So I'm finishing up some plans for my content for May, possibly into June. And I put a poll on the YouTube channel of what kind of videos you are looking for right now. Some of the big heavy hitters right now are, of course, evaluation and management, case studies for that, case studies for CPC prep. Modifier 25 is huge right now. A lot of people are very upset with some of the regulations Cigna has put out. We've seen issues with 25 modifier for years and years and years and years and years. And it's not unusual for insurances to maybe reduce payments for those services when we have an office visit and a procedure on the same day. They might reduce the payment for that. But what Cigna has done is fairly unprecedented. They've decided that they are going to place documentation requests for any service that is billed for office visits 992 12 through 99215 with the 25 modifier when you're billing the procedure on the same day. So, modifier 25 is a very hot topic right now. So, happy to cover that. But yeah, let me know in the poll on the channel what kind of topics you would really like your heavy hitters that you want to see. So, let's talk about the different types of medical coding. Oh my gosh, my deck. Hold on one second. My deck set up wrong. It's set up to my different system. Stream Deck. And I can't switch over if I don't have it set up. Why is it set up to TikTok right now? It's set up to my TikTok setup. Let's see. Oh no. There we go. So yeah, in case you guys don't know, I know not everyone is a fan of TikTok, but I did start live streaming there as well. But so with the systems that I use, I can live stream all at once through Facebook, YouTube, LinkedIn. I cannot add TikTok onto that. So TikTok lives have to go totally separate. So I do those now too. And those are very casual. Okay, now I can do my shares. Left. No, I keep hitting the wrong button. Oh my gosh, Victoria. Okay. So let's talk about the different types of medical coding we have because, our most popular credential that we have out there is usually the CPC. And people, they kind of generically get into medical coding, they get the CPC and they think that that means they can do any and all types of medical coding, but not always. There are different types of medical coding, and people even get confused when they see. And if we look here in our section on the left, top left, professional coding. So when we talk about professional coding, when you're a CPC, a certified professional coder, technically, that doesn't mean that you're like a professional, like, "Oh, I know what I'm doing because I'm a professional coder," versus being an unprofessional coder. It's not professional versus unprofessional. It is professional as in professional meaning provider-based services, professional fee services. So professional coding or pro fee coding, you'll hear it referred to, is coding for those services that are done by healthcare providers, billable providers. Think your family care physicians, your podiatrists, your surgeons, services that are rendered by them. It could be surgery, it could be psychiatric services, but the reimbursement is for the services that are rendered to that particular provider, right? Our E&Ms, surgeries, psychiatry, medicine services, it's anesthesia, right? And that gets billed out on our CMS 1500 form. If you've been in the industry for a while, you may hear it referred to as a HCFA 1500 form. It is now the CMS 1500 form. And we use different code sets for that, right? We use CPT, we use ICD-10-CM, and we use HCPCS. So if you're going to get certified to do professional fee coding or pro fee provider-based coding, those are the code sets you're gonna work with. Those are the code sets that are gonna be tested on for the exam, and then the 2 primary certifications for that are the CPC, the AAPC. The equivalent of that would be through a HEMA, the CCSP. So the Certified Coding Specialist Provider-Based. Great. Versus outpatient coding. So some people get confused between professional coding and outpatient coding. There is a difference, right? And there are professional services that are rendered in an outpatient setting. There are professional services that are rendered in an inpatient setting. If you think of someone like a hospitalist, right? The people that usually round in the hospital and they knock on the door and go, "How you doing today, Mrs. Jones?" And they come over and they feel your belly and mess up all your medications and all that stuff for the day. So if we're talking about the billing for their services, right? That's still professional fee services where the reimbursement is for the service that's rendered by the physician. That patient, though, might be admitted to the hospital, right? So it's not necessarily the location, it's what are we billing for. The professional fee services are gonna go out on that CMS 1500 form. Those inpatient services get billed out on a separate form. It's called the UB04. So outpatient services are for services they can be rendered by providers, but we're talking about from a billing aspect, we're billing for that facility, the outpatient facility. So services that might be rendered in, for example, ambulatory surgery centers, clinics that are considered part of the hospital, but the patients aren't formally admitted to the hospital. It could be diagnostic centers. So there isn't a formal admit to inpatient services. They are not in for a long inpatient stay. A lot of times, even though we have a separate credential for outpatient coding because the code sets are the same, for the COC, you still have to know ICD-10-CM, CPT, and HCPCS. It's just the reimbursement structures. You have to know about the difference between the outpatient prospective payment system versus the inpatient prospective payment system, how to bill for the facility services on that UB04. Um, Oftentimes, positions that are listed as outpatient might still take a CPC credential, right? I've seen people that have a CPC that can land outpatient facility coding positions. I think point where a lot of confusion comes in too is if you look at our ICD-10-CM guidelines, we have our outpatient guidelines and we have our inpatient guidelines. But technically speaking, when they say outpatient and inpatient, we're not talking location. We're talking The billing. We're talking about the outpatient guidelines pertain to when we're billing on that CMS 1500. The facility is inpatient billing on the UBO4 when we're reimbursement for the facility. So people will sometimes mix up those terms, um, first listed diagnosis and principal diagnosis, and use them interchangeably, but they're not. If we're talking principal diagnosis, we're talking about reimbursement for the inpatient facility being billed on that UBO4. If we're talking about first listed diagnosis, that's pertaining to things like provider based services or things that are getting billed out on the 1500 form. It gets very confusing. So, back to the slides. So, inpatient coding is the patient was formally admitted to the hospital, and this is what I kind of refer to almost as their room and board, right? All of the services that are bundled into that inpatient stay, the patient's use of the nurses, the patient's use of the bed, the medications that are at the hospital, the tissues at the hospital, all of that. And those services are then reimbursed to the facility, UBO4 form. It's paid under the inpatient prospective payment system, and we use different code sets for that. We use ICD. So the different credentials will test you on different code sets. I think the CIC, which is the AAPC's credential for inpatient coding, you're only allowed the ICD-10 CM and the ICD-10 PCS. The CCS exam through a HEMA allows you PCS, CM, and CPT, but there's no HCPCS questions. Although I think inpatient coders do sometimes, depending on what exactly they're doing, use HCPCS codes. So if we look at this, there's a whole different code set there listed that we haven't listed in any of these other credentials, right? PCS. So while you could possibly get your CPC and land an outpatient coding position because you know some of those code sets, right? If you're a CPC and you don't know ICD-10 PCS, you will have a very hard time landing an inpatient coding job. And if you're looking at an inpatient coding job, it's probably not one that you are qualified to do if you don't know PCS coding. But again, if you're someone coming on to the industry and you're like, I'm a medical coder, and you're just looking medical coding positions, you might not understand at that point yet that an inpatient coding position, if you're coding inpatient facility and they want you to know PCS, that's not going to be a good fit for you because you don't know PCS coding. The CPC exam doesn't test you on PCS coding, and it's not something that you can learn quick. Like, it's not like, "Oh, I know ICD-10 CM, it won't be too hard for me to learn PCS." They are totally, totally different code sets. It's the difference from, like, ICD-10 to CPT. The structure is totally different. So it's oop, I'm all blurry. What's going on here? Whoop. So the camera that I'm using now is the Elgato Facecam Pro, and I like it, but there's a couple of caveats to it. It blurs out for some reason sometimes, and I don't know why. Maybe it needs a firmware update, I don't know. Um, and it always picks up the redness on my face for some reason. Anyway, back to the slides. So inpatient coding, credentials CCS and the CIC. Historically in the industry, if you are someone that wants to get into pro-fee outpatient or risk adjustment coding, you want to get your credentials through AAPC. They do have an inpatient coding credential. It's starting to gain some popularity, right? But historically, so much inpatient coding has been done has been equated to a HEMA. So they oftentimes in inpatient coding positions will look for that CCS credential through a HEMA, just because that's what they've always kind of looked for. There are more employers, more recruiters, more organizations that are willing now to take the CIC because they're starting to recognize that's sort of an equivalent version of it, and not everyone wants to have to pay 2 membership dues. So they're starting to accept it more. It's becoming more widely accepted. Um, so you can become members of both AAPC and AHEMA. Problem with that is each of them will charge you membership dues. So you have to pay membership dues to AAPC. You have to pay membership dues to AHEMA. You have to get continuing education units for AAPC. You have to get continuing education units for AHEMA. Sometimes the CEUs will cross over, not always. But that's a lot to keep track of, so that's why people tend to either get credentials through one or the other because it's tough to manage both, right? So and you can have both, just understand again, 2 membership fees, 2 sets of CEU dates that you're gonna have to keep track of, and all that goes with that. Let me know in the comments if this is making sense to you right now, because I just wanna make sure that we're all on the same path. Look at that, my pointer. Okay. Um, Look at this nice little pointer. So I've made this slide up in Canva. I don't usually present in Canva, but I just wanted to kind of quick and dirty do this. Look at that cute print. I wonder if I can change the color of the pointer too. Remember, this is probably dating myself. Remember back in the day when you used to download Windows and you could, like, customize your and maybe you still can, and it's just not as easy these days, but you used to be able to customize your pointers and your icons, and you used to I mean, at least I used to. My icons used to have, like, Sailor Moon on them, and I used to have, a cursor that had, I don't know, maybe Darkwing Duck or something on it. In any case, risk adjustment coding. So, risk adjustment focuses on primarily diagnoses. So when you're testing though for the risk adjustment coding certifications, it's not just diagnosis coding. We're not just testing on ICD-10-CM. We're also testing on the payment methodologies, the thought process, the different reimbursement structures, how Medicare has their programs, how Medicaid has their programs, a little bit of what's going on in the commercial programs. And this focuses not on necessarily every ICD-10-CM codes, but the ones that we recognize as high cost, right? Things like cancer, stroke, heart attack, diabetes, not so much your cough and cold and knee sprains and things that are more acute and going to heal in a predictable period of time. So the code sets for that is ICD-10-CM. The credential is the CRC. Now, again, if you are someone who has a CPC, you're trained in professional fee coding, you know ICD-10-CM. So in some cases, they will, for risk adjustment coder positions, take a CPC. Some of them will take CPC or CRC. Some of them will take CRC. Some of them will just say CPC. It depends. But the core of it is they want to make sure that you know a good amount. You're very, very handy with ICD-10-CM. The preference of taking the CRC versus the CPC is when we look at the breakdown of what's on the CPC exam, it's heavily focused on CPT coding, right? Our current procedural terminology. There's a handful of questions about ICD-10-CM, but not nearly with the breadth and depth of knowledge that you would need to have to pass the CRC exam. So, da, 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 da. The dampness is tickling my throat a little bit today. It's making it a little dry. So, I think the core of it is really to understand that because these different types of coding, different types of medical coding, different types of medical coders have different code sets that they use, that some of them there's a little bit of crossover. So you could do a CPC or go for outpatient coding or go for CRC, but you can't like go for inpatient coding. Um, and maybe do like pro fee coding. They're very different. And the PCS coding again, not like any of the other code sets. So, this is something to keep in mind when we're looking at jobs. So if you have your CPC and it says inpatient coding, it might not be something that is something that you're qualified for, right? And you might be actually doing a disservice to yourself if you're applying for something that's going to require PCS coding and you don't know ICD-10 PCS because now I don't want to say you're wasting your time, but it's clearly something that you're not going to be qualified for. So let's kind of take a look. Let me get out of these tabs here. And let's take a look at I'm going to pretend like I'm a new medical coder. I just graduated from medical coding school and I don't have any experience and I'm looking for jobs, right? So here we go. I'm gonna see one of the things I like to do is instead of searching for medical coder, which you can, it's not a bad idea. But sometimes if you break it down by skill set instead and search for something like ICD-10 CM, and we're going to search for remote positions, it'll come up with a lot of jobs that want that skill set, someone who knows ICD-10 CM, and they might not necessarily be titled medical coder. It could be a billing job, it could be something where I'm at least working with the code sets regularly, and that's a key. Even if you can't find a job that the title is medical coder or medical coding specialist, get something where you can at least try to get something where you can use code sets in that job. Um, if you're even having trouble with that, try and get anything in healthcare that you can find. Registration, scheduling. But ideally, you would want to have something where you can at least have some touch onto the code sets because one of the requirements, if you are a CPCA and want to remove your apprenticeship status, if you want to use the years of experience, is you just have to be using the code sets daily, like frequently in your job. Not necessarily that you're the one abstracting the codes, but using them in some fashion, right? So let's take a look here. So let's say I'm looking for a coding position and I want something remote. Okay. So the first thing that's going to pop up is remote inpatient coding specialist. So again, if I'm someone who has a CPCA, this is likely not a job for the type of coding that I trained in. So let's take a look at it. And we might get distracted because we might look at it and go, "Oh my god, yeah, I definitely would wanna make 30 to $35 an hour. I'm just gonna go ahead and apply to this." But understand that's because it's a position that has that PCS coding, which is, I personally, because I do Profi coding, I find it more difficult, but if you've started out with PCS coding, you'd probably find it easier. So if we look at this, let's take a look at the job details. So this one's for health information associates, and this is kind of a little bit of information about their company. Inpatient coding specialist positions are all requested inpatient medical records using the most accurate and appropriate ICD-10, CM, and PCS and DRG assignment. Okay, so those are some key things here. So if you're someone that's, again, trained in your CPC and you don't know PCS coding, this is not going to be a good fit for you because they need someone who does PCS coding. They need someone who knows how to assign an MSDRG. Um, and it goes on abstract key data required from medical information. Now, not saying that maybe you're like, you know what, these inpatient coding positions are paying pretty well. Maybe I should go back and get my CIC and start learning some PCS coding, right? Like you can totally do that. That's fair enough. You don't have to wait a certain amount of time to go and get a second credential. You basically just need to get enough training that you can pass the exam, right? So if we kind of look at this, the bullets are giving us a listing of what what this job is going to entail. Okay. So coding all requested inpatient acute care records using the most accurate and appropriate ICD-10, CM, DRG assignment within coding guidelines. You're going to be extracting codes, assigning necessary demographic and clinical data, and you're going to use 3M and TrueCode encoder. So you need to know what an encoder is, right? An encoder is a program that helps you with code assignment. There's different degrees of how helpful encoders are. To me, an encoder is something that I can type in something like liver, and it'll say to me, okay, what are we doing to the liver? Are we doing a imaging of the liver? Are we doing a biopsy? Are we excising part of it? What are we doing to that liver? And then from there, it'll give me continued prompts to help direct me to, okay, I think it's this code. Like that's what I think of when I think of encoder. But we also will use encoders kind of in a generic way of any kind of helpful code search tool. So sometimes people will say, oh, well, Codify is a encoder because it helps you search for codes, but not maybe in the way that a 3M encoder does, where again, I can put in something like eyeball. Did we scan the eyeball? Did we do a study of the eyeball, etc.? Was it the right eyeball, left eyeball? Um, as far as training for those, if you're someone who's like, you're looking at this and you think to yourself, um, you know, I want to learn 3M or I want to learn TrueCode. Some of these positions you can I'm sorry, some of these programs, you can find some information online. So, like 3M, you could probably find some demonstrations for. True Code, you could find some demonstrations for. Some of the things like the medical record software is a little bit harder because they can't obviously show you active records in there because they would be showing you patient information, which would be a violation of HIPAA, right? So it's harder to find some things, like, if you wanna train in Epic, you might find little bits here and there, but it's not something that you can take a course in, right? Epic's not gonna let you as an independent coder, like, sign on and kinda see how the medical records, work and how you use their system, and also the systems are all built very differently. So an Epic system in Montana might look very different from the healthcare system that, my local provider's office uses or my local hospital uses. So those are a little bit tougher to get some training on. So another thing it says here, maintain quality and productivity according to client requirements. And that's kind of a fair assessment of what a lot of the jobs will put down there, that they'll say, yeah, you have to meet quality and productivity standards. Some of them will give you what those standards are, but not usually. You might more commonly find them giving you the quality standards and not always the productivity standards. Some organizations might have that changing depending on type of specialty. Like some people, might code E&Ms faster than they can code cardiothoracic surgeries, right? So there might be different quality metrics within the organization, but may have the same accuracy level, 95, 98% accuracy. Complete all coding education as required within established deadlines, commit to continually improving their coding skills, and then report to the director of coding. This is a full-time position, so full-time means 40 hours a week. In medical coding, we don't always find a lot of like super part-time hours, which is frustrating because I know so many people, they're like, Victoria, I have a friend who has a Victoria, my daughter's wedding's coming up. I want to have some money extra for vacation for the summer, but I only want to work like 8 hours, like an extra Saturday. Those are harder to find part-time wise. You might find maybe a little independent practice or something that can do them, but, most of the part-time positions in coding, they're like they ask for a minimum commitment of 20 hours a week. It includes perks, 401(k), dental insurance, so those are things to look for, and this means that likely since they're giving you things like 401(k), insurances, flex spending, life insurance, PTO, this means it's not a contract position, and I'll see if I can find some contract positions so we can kinda talk about the pros and cons versus that. Monday through Friday, weekend availability. Now that's an interesting thing. So this might mean to me if I'm looking at this and I'm going, "Oh, Monday through Friday, but they want me to be available on the weekends." I'm thinking that might mean they sometimes have overtime, and they want you to possibly work overtime on the weekends. COVID-19 considerations, position is remote. People do ask me, like, "Victoria, as far as COVID-19 stuff, like, do I have to get a shot?" It really depends on the employer. Excuse me for just one second. Oh my gosh, I forgot to unmute myself, my gosh. Anyway, I was saying, I was saying about, COVID-19, right? So, historically, what's happened in healthcare for years and years and years and years is flu shot season, you would either have to get a flu shot or file for an exemption, which wasn't terribly hard to do. And if you were remote, it didn't matter. Like, you would just file the exemption and you would sit and work from home. I don't know, some places maybe didn't even require that for remote employees. But in any case, what they would do is if you were, uh, anywhere where a patient might be, even if it was the billing office and it was flu shot season, they'd make you wear a mask just so that you didn't infect other patients. It's kind of scattered as what far as what we're doing with COVID-19 vaccinations. So you might find some places that maybe still require them, but they'll allow an exception. You may or may not have to wear a mask. If you're fully remote, they probably don't care, but it's very touch and go. So I can't provide like a yes, they will, no, they won't type of answer. So when we continue down onto this particular listing, it says the education is high school or equivalent preferred. So that's interesting. I've been having more and more people coming in and asking me, "Hey, Victoria, I'm still in high school. Can I learn medical coding and maybe get a part time job as a medical coder?" You probably could. It depends, though, on this component is if the job listings say that you have to have a high school diploma or equivalent. Now, this one says preferred, right? Now, there's a difference between preferred and required. Preferred means we would like you to have that. It will make you a better candidate if you have that, but it's not mandatory, right? There are instances, the AEPC, I think, just published an article in Healthcare Business Monthly not too long ago about someone who was in high school and their mother was training for the CPC. And they said, "Oh, this looks kind of interesting. I'd like to do it too." Was able to pass the CPC. There's no age requirement on sitting for the certification exams. You don't have to be X amount of years young or old. Anyone who wants to pay the fee and sit for the exam can sit for the exam. However, if you are someone who does not have your high school diploma or your GED, just understand that when you're looking at the job listings, that might be a requirement. Although I think it's cool. I think medical coding is something that you could learn at the high school level. Yeah, Lori's saying the youngest coder is like 16 now. Yeah, we have someone who's seriously a teenager and is certified through the AAPC. I keep telling my daughter because my former mother-in-law is also a CPC. I'm a CPC, and I'm like, "Lizzie, do you want to be like the third generation CPC?" And of course, she's 11. She's like, "No, I'm going to be a gaming YouTuber." And I'm like, "Oh, you're going to be a YouTuber like mommy?" Like, no. My kid, you would think that 11, my kid would think it's cool that her mom is a YouTuber, but she doesn't mention that to anyone because what I do on YouTube isn't cool. It's not I'm not Mr. Beast, so I might as well be dirt. So excuse me. License certifications, this particular one is looking for the CCS, and that is required, meaning you have to have the CCS. Some positions, they will put on their listing, okay, you have to have the CCS within 1 year of employment or 2 years of employment. This one in particular required. So if you do not have the CCS, I personally, you may have different thoughts. I personally wouldn't apply for this because I don't have a CCS. If I didn't have a CCS, I wouldn't apply for it. Work location is remote and it does offer health insurance. Okay. Not too bad. And Kiwi Tech is a good company. They are a good company. Trying to think, did Kiwi Tech? Yeah, Kiwi Tech sent me a box of chocolates a couple months ago because I referred someone to them that was looking for some outsourced coders. So again, inpatient coder remote, we won't look at that one because it's kind of the same. I don't think I'm on mute right now. I unmuted myself. My light is green. Uh, okay, here's one, billing specialist. So again, we have one here now that because we just looked for ICD-10-CM, we pulled up some stuff that's not necessarily coding positions. So if we look at this one, let's see what they're saying as far as what they're looking for. Scrolly, scrolly, scroll. So this is one, and it has a salary 22 to 24 dollars an hour. I wouldn't rely too heavily on what Indeed provides? Because I've not submitted a position on Indeed, so I don't know if this is what was input by the company or if this is something like pulled by Indeed. If anyone knows, let me know in the comments because I'm curious about it. So this one, blah 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 about the company, right? Basic purpose: billing specialist primary responsibility is to ensure timely and accurate processing of approved timesheets and invoices. Timesheets, really? Okay. The billing specialist will also research and resolve all provider and client inquiries in a timely and customer focused manner. Now, this is telling me, ooh, I wonder if this is something, it's saying provider and client inquiries. I wonder if that means client patients, or I wonder if that means client insurance representatives, because that could be something I don't want to do if I don't want to have to deal with angry patient phone calls, right? So we might have to read this a little carefully. Essential functions: take ownership of the error-free completion of the entire weekly bill cycle to include I'm sorry, like they really inflated this, holy crow. Invoicing all customers based on customers' billing cycle for all hours worked, and other revenue, including travel, bonus, and housing subsidies. That's kind of interesting because this to me doesn't sound yet like a medical billing position, right? It says it's at a healthcare organization, but to say travel, bonus, and housing subsidiaries doesn't sound to me like we're billing for patients. Accurate and timely processing of all adjustments, internal shared services requests, timely research and resolution of all billing inquiries to the assigned mailboxes. Let's see where it says anything here about fee-based billing, RPO, per placement. Okay. I'm not seeing, where does it say even in here ICD-10 CM? 3 to 5 years, demonstrated analytical sense, understanding of medical terminology in compliance with ICD-10 CM. See, to me, this doesn't even sound like a regular billing position. This sounds like maybe reimbursement for, I don't even know, residents? Cross-country healthcare. So this would be one I would probably skip. This looks promising. You know what? Let me show you some cool things you can do. Cool thing you can do if you're someone who has no medical coding job experience or very limited. One thing you can do is in your search here, you can filter by experience level. Okay. Entry level. Now, this the filter on this sometimes is a little touchy. So it's based off of what people have input. So if someone doesn't understand what an entry level medical coding position is and they put on something that says it requires 2 years experience, it'll still pull in under that. So it really is reliant on the user input for this. But a good way to filter if you want to. So let's take a look. Outpatient beginner coder. Now that's piquing my interest, right? Outpatient beginner coder. I usually never hear them referred to as beginner coder. It's usually apprentice coder or entry level or coding assistant, something like that. Outpatient beginner coder. So what does a beginner coder do? Full time. And I think we have this filtered for remote, right? Yeah, it's still filtered for remote. So that's not a starting amount, 21 to 27. Potential $5,000 sign-on bonus for external hires. Now, here's the thing to pay attention to because I'm seeing this more and more too. Remote coder positions are available only in the following states: Florida, Connecticut, North Carolina, South Carolina, et cetera, et cetera. Ooh, Pennsylvania, which includes me. So something to make sure that you're checking as well. And some of these remote positions, they're only allowed for certain states. It does offer full benefits, PTO, tuition reimbursement. That's a good perk too, especially if you're looking to go and get your um hold on one second. Who the heck keeps messaging me? I got these messages popping up and I apologize if that's distracting anyone because I wanted to have LinkedIn open. People are messaging me there and now it's popping up. Okay. Too much going on LinkedIn these days. Okay. Now it'll at least stop popping up. Okay. So this one is outpatient beginner coder. So I'm thinking outpatient coding, COC, billing for outpatient facility. let's see how it goes. Let's see if that's what this actually is. Appropriately analyze and code complex outpatient records. Okay. High level expertise in coding and documentation guidelines, comorbidity, major morbid conditions, extensive knowledge of CPT and LCD. And this was local coverage determinations, right? And appropriate reimbursement and compliance. Okay. Kind of an unusual thing to throw the LCDs in there. Responsibilities perform ICD-10-CM diagnostic and current procedural terminology, procedural coding. Who wrote this? Performs ICD-10-CM diagnostic and current procedural terminology, procedural coding. Current procedural terminology, procedural coding. Yes, procedural coding would be procedural. Thank you. Coding to maintain an accurate database and ensure accurate coding. At a minimum, accuracy. Accurate coding and accurate coding and accurate coding at an accuracy rate. Okay. Uh, it performs evaluation and management coding for physician and facility. Ability to use either 3M encoder or ICD-10-CM, ICD-9-CM, and ICD-10-CM. Yeah, it's still mentioning ICD-9. I mean, unless you're coding charts from, oh my gosh, how many years has it been now? It's gotta be what? At least 6. So unless you're coding old charts, you're not gonna be working in ICD-9, which if you're doing stuff that old would likely be auditing, not outpatient beginner coder. So funny. Um, high school diploma or equivalent required. So yeah, this would be someone who if you're in high school and you don't have your diploma yet, you wouldn't qualify for that because that is a requirement. Requirements mean mandatory. Preferred means we would like you to have. This one though is saying they want the CPC or the CCS, which is interesting because it's an outpatient coding position. You would think the COC would be on there, right? But not so much. At least 6 months of outpatient coding experience or related experience. So I think this would fairly well qualify into entry level because maybe if you had, maybe you could stretch it. Like I would say, like, oh yeah, I've been, training for X amount of years, X amount of months, and I did, an internship or something. I would say even without that, if they're only asking for 6 months and you're like a really good candidate, you should probably apply anyway. Specialized training in medical terminology, ICD-10-CM diagnosis, CPT, and E&M coding. Okay, so that's not too bad. Um, so it's not saying specifically which training. So this is consistent with a lot of the jobs. They just want to know that you have the credentials, that you have some sort of training. Oftentimes, there's no difference from an application standpoint if you have a 2-year associate's degree training or you had a 2-month online training. They're looking for your CPC and some of them are looking for years of experience, but those are the target things that they're looking for, those credentials, the training that you had enough training to pass a certification, you have experience using the code sets. And then dental, 401ks, PTO, day shift, Monday through Friday. I think that's fairly standard, within the industry. So a lot of them, they'll say Monday through Friday day shift. They want you to work fairly consistent hours. One of the questions I get a lot is, "Oh, well, if I'm working as a medical coder and I'm remote, can I work at 3 AM? Can I pick my kids up from the bus and then go back to work?" It depends. There's a lot less flexibility, I think, with working overnight hours or working, Sundays. A lot of employers do still want you to work Monday through Friday in daytime hours. Maybe they might say, okay, well, you can start as early as 6 a.m., and the latest you can work is maybe 6 p.m. or 7 p.m. because they kind of want you to that if they need to call you for something, right, they don't want to have to call you at 2 a.m. because that's when you're working. So they kind of like to keep it consistent with typical office hours. Not saying that maybe, if your kids softball game is on Thursday night that you can move your hours up on that day or make them up on a Saturday. Usually there's that kind of flexibility, but not so much that they're like, yeah, you can log in at midnight and work until 9 a.m. So fairly consistent. As far as, again, people ask about, "Oh, can I find a position where I log on at 6 a.m., 7 I start getting my kids ready for school, drop them off, and pick up again at 8?" That's a tough one because it is so employer dependent. I have seen a lot of companies that are flexible with that, um, but you won't know that until you actually are, like, sitting down and having the conversation with them. They're not gonna put that in, the job listing, like, "Oh, yeah, you can have really flexible hours and stop for an hour here or an hour there and pick it up." Oh, well, while this is coming in, that would be a great time for me to do a plug here. So if you're looking into getting training in medical billing or medical coding, I do have a masterclass that is available. It is medicalcodingmasterclass.com, and it gives you all of my recommendations about what you should look for when you're training for this career, as well as, excuse me, as well as certifications, um, job expectations, salary, and then I tell you about Preppy, which is the program that I checked off all of the things with them, made sure that they're giving you everything you would need to succeed, right? The right kind of training, making sure that it's cost effective because that's a big thing for me. I hate these programs that are charging 20, $30,000 for medical coding when you can get the same content for significantly less. You can also go through aapc.com, um, and they have training there as well. CCO is great. Oh, I just closed my comments instead of my banner. Um, and yeah, there's lots of great programs out there. But if you go to Medical Coding Masterclass, that is the one that I recommend personally. I don't offer me personally, I don't offer certifications other than, I do training for the CRC and for the CPMA, which is auditing. I don't do medical coding. I like to call it medical coding 101 because I have such a huge fan base that there are, I mean, seriously, dozens of people that would wanna sign up every month. I mean, tons. And I can't and I don't want to expand to have to sit down. Okay, well, do you know medical terminology? No. Okay, well, you have to do this, and then you have to do this, and what's medical coding is gonna like. It's way too much volume for me to handle, which is why I'm like, okay, this is the program that I'm recommending to refer you to, which is Preppy. Starting to work on getting some more CEU stuff together, though. It's tough. I literally sat down yesterday with one of those big giant sticky notes, the easel size ones, and I'm like, okay, here are all of the things that I can do. Which do I wanna focus on? Okay, over here is YouTube, over here's Instagram, over here's all the courses I need to, do, over here is, uh, CEUs, webinars, free resources I wanna put together, over here is I don't even remember, like, there's so much stuff, and I'm just like, I struggle because I have no capacity for prioritizing and time management. So I'm like looking at all of this and I'm like, okay, which do I do first and then next? And I'm looking at the count. I'm like, I'm, I don't know. I don't know. Anyway, back to the listings. So, so that might not be a terrible one for someone who is entry level. Let's take a look at this one. This one's interesting. This one's piquing my interest. Medicaid review analyst, 55 to 60 a year. I don't know that I would consider that entry level though. Let's see if it really is an entry level position. Medicaid is our state insurance for those that are low income or possibly some disabilities, right? Medicaid review analyst will utilize claim processing, federal regulation, and state policy knowledge and experience in accurately complete data processing reviews as they relate to task order, including compliance with contract deliverables, internal and external performance requirements, and continual improvement. The position is responsible for providing support to the data processing review management staff and operations area. In assuming this position, sounds very formal. My goodness. In assuming this position, you'll be a critical contributor to meeting prime mission, like Optimus Prime mission, because that would be hella cool. I don't why is prime capitalized? What is the prime mission? You will be a critical contributor to meeting prime mission. Maybe that's a program or something that I'm not aware of. Oh my gosh, you guys, please hold on. To meeting prime mission, specific tasks, knowledge of and the ability to correctly identify insurance coverage guidelines. Okay, that's something you can do at a pretty entry level. Is look up the insurance guidelines. Familiarity with CPT codes, ICD-10 CM codes, and HCPCS codes. Okay, so this so far sounds entry level. If it says on the bottom we require 2 years experience, I'm going to be mad. Microsoft Word, Excel, and internet applications. That's kind of a given. So I think that I feel like we're at a point in tech that you really shouldn't have to list on your resumes anymore that you know Word and Excel and how to use the internet. Like, I feel like those are kind of givens. Outlook, like, I wouldn't if I was especially looking for extra space on my resume, I wouldn't include those because I feel like it's just kind of understood that you know how to write an email in this day and age. And same thing with 10 key. I'll still see people putting in, "Oh, yeah, I can key X amount of numbers, words per minute." I don't know that that's really like, I think at this point you're expected to be kind of a fast typer, right? Um, let's see here. Prime mission oh, someone's saying about I think prime mission is what's stated in the next sentence. It must be how they refer to their organizational mission statement. Okay, that I can see. That's kind of interesting. To deliver innovative, cost-effective solutions and services that enable customers to rapidly adapt to dynamic environments. I love when people write things that don't really mean things, just so that they sound super innovative and smart. Working knowledge of medical terminology and experience in the review of Medicaid electronic claims are required. Okay. Task order statement, communication internally with perm, complies with statement of work guidelines. Cool, cool, cool. Perform other projects. Okay. Are you kidding me? See, this is what kills me. So this was listed as an entry level position. Bachelor's degree or equivalent work experience and at least 1 year experience with Medicaid chip data, strong knowledge and abilities. See, this isn't an entry level position. If you're asking for a bachelor's degree and 1 year experience and all of this, I wouldn't consider that an entry level. I think this one they mismarked it. It sounds like AI. It probably did. Soon, like everything's just going to be AI talking to other AI. Um, must have no adverse actions pending or taken against him or her by any state or federal licensing board or program, which is understandable because this is a state program. Must have and maintain a valid driver's license. And then experience ability to quickly adapt and thrive in a changing work environment and ability to read insurance claims, both paper and electronic, and a basic knowledge of the insurance system. I feel like this bachelor's degree or equivalent work experience and at least one experience with Medicaid and CHIP. So I'm looking at this and here's my thought. If I was someone who just passed the CPC or someone who has experience in billing and coding, I don't know. I might still try to apply for this. Even though they're saying like bachelor's degree or equivalent work experience or 1 year experience, this might be one of those ones where maybe they don't have a lot of people apply. So you might be able to get in. I would give it a shot. I wouldn't have that be the only position I apply for, but I might give it a shot. I want to see this. So when we click on Indeed and it has the different reviews, I've never read these reviews before. Are they good? Good salary, good benefits, understanding. We're there to support one when needed. Clean place to work. Opportunity to move up. So this looks like it is helpful information. Worst company ever. I mean, you're going to get that from anyone. All right. Interesting. Okay, let's take a look though at what's going on in LinkedIn. Let me close these 3 messages that I've gotten since since starting the live stream and see if we can do some search here. Nobody send me messages on LinkedIn right now. Medical coder, remote. Let's see if we can find anything different or interesting on LinkedIn. So now LinkedIn is the same. You can filter this by experience level. You can find internships even supposedly. Again, this is reliant on if the users put that in correctly. Entry level. Okay. Now, one thing I will say, I thought it would be cool if you could search CPCA and just find jobs that are for CPCAs, but apparently it does not work that way because someone informed me that if you go into like an Indeed or a LinkedIn and search CPCA, it will also pull in the positions that say no CPCAs. So that unfortunately doesn't filter. But the best we can kind of do right now is use some of those settings here that we have now within the platforms to filter for the entry level positions. Okay. Um, what do we got here? Medical coder and MSA analyst. I don't even know. I'm gonna skim through this. This doesn't even look medical coding-y to me. RN, yeah. So right away, if I'm scrolling this and I'm seeing RN licensure, that's not a position for me. Cardiac surgery coder remote. Gosh, I am so sorry. How do I keep coughing and then muting and then anyway. Inpatient DRG coding, I know like this much inpatient DRG coding, like the basic lookup function of PCS, that much. I would have to bring someone on who knows inpatient DRG to do any kind of training on that or learn it myself, which I still am kind of considering. Anyway, um, back into back into cardiac surgery coder remote. Okay. So if we look at this, we're going to kind of skim through it. I like to skim through things first. I don't know about anyone else. What you will do in this role: review and code clinical notes, operative notes for assigned specialties. Oh, this one says charge entry of codes into the billing system. Okay. After you code them, I'm sure. Work in conjunction with the AR team, right? I'm wondering if there's a delay because I'm still hearing things that say, I can't hear you, but my green light is on. So I'm just going to give it another minute or so. Um, What you will need in this role: high school diploma or GED preferred. So this one again is one where it says preferred. So if you are someone who's in high school and you have your CPC and you do medical coding, you could apply for this position because it just says preferred, does not say required, it does not say mandatory. Minimum 2 years though of profi coding and reimbursement experience, right? So this one I wouldn't even say is entry level either. Minimum of 2 years experience. We could take a shot in the dark and still apply, but yeah. Knowledge of medical terminology and anatomy and physiology is preferred. Knowledge of pathophysiology is preferred. Coding certification through AAPC or AHEMA required. Work experience may be accepted in lieu of credential, which is interesting. Not a lot of people do that. Um, they'll usually say that you have to have it within a certain period of time if you don't already, or that you have to have it. So the fact that this one is saying work experience may be accepted in lieu of credential, kind of cool. But again, 2 years profi coding experience. What else? Charge capture. The LinkedIn's, I don't know that they give a lot of the salary information the way Indeed does. So this one's a little funny because it says 2 years experience. It's listed under an entry level. It could be one that you could apply to. Again, I wouldn't get your hopes up on it because it's saying they want 2 years experience. Let's see if we can find oh, here's a risk adjustment coder position. Let's see what this one says. Okay. And this is if we're looking at this, this is fairly consistent with what we've been seeing. Like that first paragraph or two is like literally about the company, but this is important to read if you're about to get an interview for them. Another thing you should do is let's say this company calls me up and they're like, "Hey, we want to interview you for a position." What I would do is I would Google information about the company's values, any information that they have, like what kind of whatever's on their website, and that way you can, I hate to say, regurgitate it to them during the interview. But when they say, "Oh, well, why do you want to work here?" And you're just like, "Oh, well, I feel like I personally align with this company's values of blah 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 blah," and then you just regurgitate their mission statement that they have on the website. So this one is a risk adjustment coding position, and it says AAPC or a HEMA certification. It doesn't say CRC, it doesn't say CPC. It just says that you have to have a certification through AAPC or a HEMA. Which, again, this is why I tell you people when you're looking for a medical coding credential, I have nothing against the other ones out there, the other associations. But when you're looking at these job applications, they're going to say we want a credential through AAPC or a HEMA. So if you're looking at this from a standpoint of are you going to have a better time finding a job, those are the organizations you want to get with. This one says 3 years of coding experience, ability to provide a secure work environment is a must. So, when we're working in medical coding, we're working with patient information. So we have to have a secure work environment. And some employers are much more strict with that because it's a huge liability. Others might be a little bit more flexible. Some employers, if you're working remote, they might ship you a laptop. You only use that laptop for your work stuff. They might have you sign on to a VPN. They might have, extra security measures that maybe you have to log on with your phone, so they send you a push notification or something because they don't want you to be working at Starbucks and people in the Starbucks are walking behind you and you've got stuff open on your computer with patient information and pictures of, their sacral wounds and all that. They don't want you working at home and your husband is walking behind you and looking at patient charts. They want to make sure that things are secure and that someone's not going to come in on a public Wi-Fi and possibly get into some information on your laptop. What time is it? We're past time, you guys, already. So definitely let me know if you kind of felt like the walkthrough was helpful. Oh, and yeah, Liz, so are you able to get a remote job in another state? Generally speaking, yes. So, like a lot of the big tech companies might be in California. A lot of healthcare companies are down in Florida because they have a huge Medicare population in that area, right? And some of them might have better pays than you might be getting in your state. So, yeah, you can definitely apply for remote positions in other states. However, if we remember earlier in the live stream, there was one position, and I have been seeing this more and more where they're like, "Hey, we can only take remote employees from these certain states." It might be because maybe of something like they want someone who is familiar with their Medicare contract, or it might be because of just certain regulations that they have. Maybe they can only offer certain benefits in certain states. So just make sure that you're checking those kind of things. Really thoroughly read through those job descriptions and see if there's anything that would prohibit you. So yeah, but most people in medical coding, if they have a remote position, it can be in a different state. In any case, thank you guys so much for coming in for the channel review. I will be back next Friday. I won't be back the following Friday, but I will be back next Friday. If you have any specific topics you would like me to go over during the stream, let me know. Oh, you know what, Lisa, before I go, let me talk about contract jobs real quick before I go over time. So 1099s and our W-2s, right? So contract jobs are great for medical coders because oftentimes they pay more, right? Um, but you don't get oftentimes the benefits. So they might have a 6-month assignment for you. They're going to pay you out the wazoo, but you're not going to get benefits. You're not going to get PTO. But because you're not an employee, right? There's more flexibility there. Sometimes the contractors are more structured. Other times they're more flexible. But it's something to think about because if you're going for a contract job, you're gonna have to consider, okay, am I able to get health insurance or, the benefits through a significant other that you're, with, or, can you buy it off of the marketplace? Um, I do have a video too on the channel I can refer you to about the differences between and pros and cons. So if you're interested in contract work and you're like, I'm not sure that this is for me, is a video on the channel. I'll bring it up so you guys can see it too. Uh, the search bar is a little more hidden than it used to be. So if you're ever on the channel and you're like, oh my gosh, does Victoria have a video on something? If you scroll all the way over here, there's a magnifying glass and you can search in there for the topic. So here we go. Medical coding jobs explained to 1099 or W-2, which is right for you. That will be a good video for the decisions between the contract versus the full-time employee. Anyway, I will see you guys next Friday. Looking forward to it. Definitely let me know if there is a certain subject you want me to cover. I'm happy to get comments. If you're watching this on the replay, hashtag replay, and drop your comments below as well if you found this helpful. Thank you guys so much. I will see you next week. And until then, just keep on coding on.